Post-operative instructions, wisdom teeth removal. The following will cover important information regarding the proper post-surgical care for wisdom teeth extraction. If you have been scheduled to have your wisdom teeth removed, it will be important to follow these instructions exactly as we present them. Discomfort is normal after the extraction of teeth. If you are not allergic or intolerant to non-steroidal anti-inflammatory drugs, start taking ibuprofen, also known as Advil or Motrin, or Toradol, ketorolac, as instructed by your doctor at the time of your surgery. If you are asthmatic, do not take ibuprofen unless you have tolerated it in the past. If the ibuprofen or Toradol and Tylenol combination alone does not control your pain, take your prescribed narcotic in addition. Ibuprofen and your prescribed narcotic can be taken together. Be certain to take your pain medicines with food. This will help prevent nausea. Remember, narcotic pain medicine will impair your judgment and reflexes. Take note of your total dosing of medications. Aleve, maximum 1,375 milligrams per day. Ibuprofen, maximum 3,200 milligrams per day. Tylenol, maximum 3,000 milligrams per day. Gauze pads should be placed directly over the extraction sites and held in place with firm biting pressure. Proper placement will help you not swallow blood, which can make you nauseated. Replace the gauze pads every 20 to 40 minutes, or if saturated. When the gauze pads have little or no blood on them, they are no longer necessary. The amount of bleeding will vary from person to person. Most of your bleeding will slow within 3 to 4 hours, but a small amount of bleeding is common for up to 24 hours. Rinsing. You may drink but not vigorously rinse your mouth for the first 24 hours following surgery. After 24 hours, gently rinse your mouth with warm salt water, ½ teaspoon of salt, into 8 ounces of lukewarm water, 4 to 6 times daily. Continue rinsing until you return for your post-operative exam. You may gently brush your teeth the day after surgery, being careful in the area where the surgery was performed. Swelling. Swelling is the body's normal response to surgery and the beginning of the healing process. It varies among individuals and according to different procedures. Swelling will increase over the first 48 hours and subside over the next few days. Apply cold packs, 15 minutes on, 15 minutes off, for the first 36 hours while awake. After this time, you can apply moist heat compresses for the next 36 hours. Keep the head elevated for the first 72 hours using pillows under the back and head while sleeping. To allow blood clots to form undisturbed, do not eat for 2 hours after surgery. Start with clear liquids such as apple juice, tea, or broth. Gradually ramp up your diet as tolerated. Frozen desserts, smoothie, or milkshake with a spoon is okay. Always cool down any hot foods or liquids during the first 24 hours. If you were sedated for surgery, do not eat fatty, creamy, or oily foods. These foods may cause nausea. You should eat only soft foods for the first week. For example, baked fish, soups, eggs, mashed potatoes, and meatloaf are fine. For 2 weeks, 8 weeks if you had lower wisdom teeth extracted, do not eat hard, crunchy, or very chewy foods, such as European breads, pizza crust, steak or jerky, nuts, or popcorn. To help prevent dry socket, do not use a straw for the first 3 days after surgery. Begin brushing your teeth the day after surgery. It is important to brush all of your teeth, even if the teeth and gums are sensitive. Bacterial plaque and food accumulation near the extraction site will delay healing. Do not smoke for at least a week. Smoking will increase your bleeding. The nicotine and tar in tobacco impair healing and may cause a dry socket. Unless told otherwise, do no vigorous physical activity for 3 days following your surgery. Physical activity increases your blood pressure, which will cause an increase in your swelling, pain, and bleeding. You may gradually increase your activity, such as jogging or tennis, 5 to 7 days after your surgery.